internal medicine. All right. So a middle-aged man reported to you with an unexplained weight loss, unexplained, for 4 good months. He feels better when the room temperature is low, guys. When the room temperature is low. You know, people who have low thyroxine level, they love low temperatures. They love low temperatures. So that could be a reason, because people with high thyroidism or high thyroxine, they are heat intolerant. Okay, they are heat intolerant. So the one thing that I would low. Sorry. So over here we're talking about hyperthyroidism. Sorry. So increased level of what? Thyroxine. So they become heat intolerant. So they want cold weathers. So you defined. Now you notice fine distal tremors accompanied by an irregular pause. Irregular pause. Again, there are what? Tremors. Okay. So now let's look at the question that follows. List 3 conditions associated with weight loss. So under what conditions can we have weight loss? Now, let me try to classify them for you so that it will be easier for you to get them right. So we can consider what we call endocrine or metabolic conditions. Endocrine or metabolic conditions. Example, hyperthyroidism. Type 1 diabetes mellitus. Hypopituitarism. Hypopituitary gland. Pituitary gland function. Then anorexia nervosa. These are the people who, in their mind, they are fat, so they want to be slim. Anorexia nervosa. So they don't eat. Then we can talk about Addison's disease. Addison's disease. That's to do with the adrenal gland. Addison's disease. So again, what are some of the endocrine or metabolic conditions that can lead to this condition or weight loss? Hyperthyroidism, type 1 diabetes, hypopituitarism, anorexia nervosa, Addison's disease. All right. 5 causes of tremors. 5 causes. Guys, sorry. Before that, let me add GIT diseases or GIT. So let's go back. Let's talk about GIT disease that can also lead to weight loss. Celiac disease can lead to weight loss. Crohn's disease can lead to weight loss. Then peptic ulcer can also lead to what? Weight loss. Or ulcerative colitis can lead to weight loss. Let's talk about CNS disorders or brain disorders. CNS disorders. We can talk about depression, Parkinson's disease, dementia. Depression, Parkinson, dementia. These things can also lead to what? Unexplained or can lead to weight loss. Then other causes could be cancer, could be parasitic infection, drug abuse, side effect of some medications, alcohol abuse, etc. That was just by the way. So out of these, just mention 3 and you're good to go. Now give 5 causes of tremors. 5 causes of tremors. Causes. So over here, you can think of what? Multiple sclerosis. You can think of stroke. You can think of brain injury or traumatic brain injury. You can think of Parkinson's disease. You can think of alcohol abuse or withdrawal. You can think of hyperthyroidism, mercury poisoning, liver or kidney failure, anxiety or panic disorder. Guys, there are a lot of them that can cause tremor. So just mention 5 out of the lot I've mentioned. Multiple sclerosis, stroke, traumatic brain injury, Parkinson's disease, alcohol abuse or withdrawal, mercury poisoning, hyperthyroidism, liver or kidney failure, anxiety or panic disorder. All right. Now, 3 eye signs associated with hyperthyroidism. Eye signs, eye signs. So basically, you are going to be looking at what? Periorbital edema, periorbital edema, conjunctival edema, conjunctival edema, late retraction, late retraction. We can talk about late lag, late lag. Then exophthalmos, exophthalmos. Also, people can pronounce it as what? Proptosis, proptosis or exophthalmos. That's an abnormal protrusion or displacement of an eye, an abnormal protrusion. So, again, we have exophthalmos, late lag, late retraction, conjunctival edema, preorbital edema. These are the eye signs associated with hyperthyroidism. All right. Tests. What test will you do to confirm? So to perform in this patient, what test will you do to confirm in this patient? So definitely you are thinking of what? Hyperthyroidism, isn't it? So what you do is thyroid function test. Thyroid function test. You can also do glucose test. You can do ACTH test. ACTH test. You can do endoscopy. You can do biopsy. Again, thyroid function test, glucose test, ACTH test, endoscopy. Then you can talk of biopsy. But the most important one among all of them is the thyroid function test. So if they ask to mention just one important test to do, you are going to look at for what? Thyroid function test. But the question is specific on the number of answers to give. You can give as many as you can remember. All right.